Here we go.
You can imagine if you're a patient and you want to go home, you want to be stuck in a hospital bed. It's not where anybody wants to be. You want to be back in familiar surroundings with your friends, family, coming and going as you please. But there's this blockage for you getting out. So you're stuck in a hospital. Now, for the frailest of society, we know they don't do so well in a hospital setting.
Hi, and welcome to the Chasing Care podcast. On today's episode, we'll be exploring bed blocking in the NHS. And I'm delighted to say I've been dying to speak to this person, and this is genuine. She is Home Care Businesswoman of the Year in 2023. Her business itself has got a Princess Royal Training Award for training caregivers, and she's the Vice Chair of the Home Care Association. So if this person can't help us with the problems that we face in the industry, God only knows who can. So I'm delighted to say, welcome, Lucy Campbell from Right at Home.
Hello, thank you for having me. And what a lovely introduction. Very much appreciated. Thank you.
No worries at all. For our audience, can you just paint us a picture? Just tell them a little bit about Lucy and who you are.
Absolutely. So, as you introduced me, my day job is CEO of Right at Home UK, and I do also sit on the board of the Home Care Association as deputy chair. So, in my Right at Home role, we are a national home care company at the quality end of the scale. We're a franchise network, so we've got over 80 locations across the UK. And in England, we're very proud that we have 34% of our offices rated as outstanding by the regulator. So that's the CQC. And that's against a national average of around 3%. So we do put a huge amount of emphasis on quality. Our franchise offering spans across every area of support an individual could want in terms of running a home care company. So obviously the regulatory support around quality and compliance, etc. But we also provide all of the support on the commercial side. So marketing, recruitment, training, business planning, etc. And we're really, really proud that we're one of only 3 brands to hold the 5-star franchisee satisfaction status, which is based on an independent survey given to all franchise owners. And we've got that for 11 consecutive years.
Wow, that's truly incredible. So well done, everybody there, your team and all the franchisees, because without them, you wouldn't have a story to tell.
No, absolutely not. We're very, very blessed that we have a network of phenomenal individuals. Most of our franchise owners come into Right at Home because they want to get out of the rat race, often had amazing careers, but they really, really genuinely want to make a difference. And that's really important to us. And they live and breathe the values of Right at Home and support thousands of people a day throughout the UK.
Okay, and before we jump onto the core of the subject I will talk about today, which is about the NHS and bed blocking, and all the issues that go around that, can you explain? You use the word quality end of the market. Most people wouldn't probably understand what you mean by that because they don't understand what the market is. So can you just paint a picture again for people that don't understand? What do you mean by quality end of the market?
Absolutely. So no doubt the general public will have seen some less than positive stories portrayed by the media in terms of care people receive in their own homes. Now, obviously, or maybe not so obviously, but it seems obvious to me, everybody wants to stay in the comfort of their own home. We know people do better when they are able to recuperate at home and get the care and support that they need. Sadly, a lot of the care which is provided by the government, so in the non-private space, is commissioned sometimes by the minute, which means that caregivers don't have enough time to provide the care and support that they want to get the most meaningful and positive outcomes for the individual receiving care. Now, at Right at Home, we are fortunate that we have around 70% of our work is private, but we do government funded work, both in the NHS space and also via the local authority. but we won't do 15-minute visits because we don't believe a quality offering can be provided. So generally speaking, most of our visits last for at least an hour, and they're very much focused on getting the outcomes for that individual achieved. So person-centered care is one of the buzzwords within the industry, and we absolutely live and breathe that. And it's about supporting an individual, not just with the typical personal care tasks you might see and associate with home care, but actually supporting individuals to live as independent life as possible and doing all the things that really make them feel whole as an individual, the things that are really, really important to them.
And we'll probably come back to some aspects of this when we talk, because bed blocking, I looked at some statistics. In fact, let me just underpin this. Let's come back to something before I go on to what I was about to say. You indicated that most people want to stay in their own home. I'm guessing that most people don't want to be sat in a hospital. And how often have we heard the phrase in the sector, I just want to go home. I just want to go home. And the harsh reality is that there's a major conundrum here, isn't it? What
Yeah.
we're going to hopefully do, and this is why you're here today, to help the audience understand what their options might be. But let's just lay it out fundamentally. Recent data, 14,436 patients, that's an increase of 20%, are stuck in a hospital bed and they don't need to be there. These are statistics the government publishes.
Absolutely.
13% of hospital beds in England, 13% are filled with people in a hospital bed that shouldn't be there. They should go home. They are able to go home, but they can't. And let's look at the real shockers. I love these statistics, but in a bad way. Croydon, 33% of beds. Wigan, 29%. Isle of Wight, 28%. North Bristol, 26%. And the shock is that governments might say, and I'm not blaming the government because NHS is burdened and the government's burdened and all these things, and they've put lots of money. But 19 out of 20 new beds, the beds that they've made available by creating more wards, by building new hospitals, 19 out of the 20 are already filled. So there's a problem. It's a massive problem. And I'm just going to finish. Let me finish, Lucy. I know you're gagging to get on this, but I just want to lay the facts for the audience because it's really important. The King's Fund, which is a body out there that are really good at finding data about the care industry, about King's Fund, they've calculated it costs the NHS £395 a night. That's £1.9 billion of taxpayers' money in 2022-23. Shocking. I just want to go home. Lucy, over to you.
Yeah, no, absolutely. I mean, I was literally going to respond with that very quote from the King's Fund because it's an absolutely staggering amount, isn't it? And so it stands to reason that the government should be looking for a solution which can, one, prevent people going into hospital in the first place, but on the other hand, try and accelerate that hospital to home journey for individuals. And something that gets talked about a lot in the sector is something called integrated care. And effectively what that means is organisations that work in the space where Right at Home works, so they can provide services in the community. So that is anything from residential care through to care at the home, starting to provide services which would have traditionally been carried out in a healthcare setting. And obviously that then alleviates pressures on the NHS and starts to bring down those costs. Sadly, the true integration between health and social care is just met by so many challenges. We are a long way off actually from seeing that really, really happen in reality.
Yeah, and I know they've done a pilot I can't remember which part of the UK they did a pilot where they were talking about virtual wards and trying to run it outside of the hospital. Unfortunately, the statistics, again, the data, the evidence says that it costs twice as much money to have somebody being looked after clinically in their own home as if it's a hospital bed. Now, I would stress that that's a very small percentage of people that are actually being looked after, and it was just a pilot. And there could be lots of reasons for that. There could be some form of critical need rather than some that's generally being let go from the hospital or being cared for at home. But yes, I think I fundamentally have to agree with you that we've got to look for alternate solutions. So I'm guessing, Lucy, you might have some thoughts on what the alternative solutions could look like and how the public should go about trying to source those for their benefit.
Yeah, absolutely. So I think we'll focus on first and foremost in terms of kind of freeing up the beds effectively. So you're an individual, you're in a hospital, and the first scenario is that medically you are fit to be discharged from hospital. Now, but you might have some needs of support, maybe some personal care. You might need some assistance with wound dressing, etc. But fundamentally, there is no need for you to be in a hospital setting anymore. So you're waiting to be discharged. Now, normally, what you should be offered is a reablement package from the NHS, and it's six weeks normally. And the idea of this kind of intermediate care offering, if you like, is to get you home, attend to those basic needs that you need in terms of support, and then back into independent living. Now, sadly, the first barrier there is the delay of actually being able to get you back into home because of a lack of capacity from the district nurses, etc., to provide that very, very basic support. So you can imagine if you're a patient and you want to go home, you want to be stuck in a hospital bed. It's not where anybody wants to be. You want to be back in familiar surroundings with your friends, family, coming and going as you please. But there's this blockage for you getting out. So you're stuck in a hospital. Now, for the frailest of society, we know they don't do so well in a hospital setting. So you can actually start to find that perhaps people's conditions might start to decline the longer they're in hospital. So again, it's really important to get people back into their homes as soon as possible. So if you are in a more fortunate position where you can pay for a service, the first thing we would be saying is to ask for information from private providers to see if any of those providers can provide a service which mirrors what you would get from the NHS. So at Right at Home, via the delegated task route, we have caregivers that are trained up to provide the services which will be traditionally carried out by district nurses, etc. And that can be provided, and you can then effectively accelerate your journey from hospital to home. And that's wonderful, isn't it, for people who can actually afford to pay for care. And it absolutely should be a patient's own decision to be able to do that. But sadly, the education piece is missing. And often the people that are advising patients at the bedside and wards just are not aware of the services which are provided by the private sector. However, my view is that a lot more could be done in the funded space if we were seeing the integrated healthcare agenda working properly. So we should be seeing services being commissioned to social care providers like Right at Home, but there are many other wonderful ones across the UK to alleviate the pressure on the district nurses, etc. Now, we know that there have been, as well as those staggering statistics that you shared just a little while ago in terms of the number of patients that are in hospital, we also know that 1 in 6 patients over the age of 75 are readmitted within 30 days of being discharged, which again, as you can imagine, again, is a very, very vicious circle, and it's certainly not doing anything to alleviate the pressures on bed blocking. So surely that really does ring alarm bells in terms of a real need to start to provide better care provision in the home. And unfortunately, because of funding restrictions and again, a lack of good communication between that free service, which is offered in the first kind of 6 weeks as an intermediate service, and then the need to maybe enhance that package into a medium to long term package is not happening, and people are just ending up back in hospital. And as I said before, when that happens, usually health declines further, and that's without even starting to go into some of the more kind of mental health and emotional impacts of such a journey.
Lot to unpackage there, as ever. It's never going to be simple, is it?
No.
I've got two questions. While you were talking, I was thinking to myself, what can Joe Public do, patient? What can care providers do? We've got to change the dynamics. You talk about this integrated solution. You talk about they need to understand what you offer or the solution that you could provide as a private provider. I mentioned earlier, what was it, the £395 per night. So I'm not very good at the maths, but it sounds to me as if a care provider might be cheaper. I don't know, could be cheaper for a week than having somebody in the bed for a week. It just has £2,100 odd pounds a week in my head, something like that, or maybe a little bit more if they stay in a hospital bed. Whereas it probably isn't going to cost 2,000. I mean, I don't know. Maybe it is. You tell me. But so there's that dynamic. Is there maybe even a cost saving? How do you educate the people at the hospital? You said that they're not maybe aware. Is it their fault? Whose fault is this, Lucy?
Well, I think we will probably definitely lay a good proportion of fault at the government's doorstep for sure. I mean, first and foremost, the whole commissioning structure across both kind of NHS funded care and local authority funded care is broken. It's not regulated, and we know for a fact that in many areas across the UK, sadly, care is not funded at a rate which allows for quality care to be provided in the home, particularly as we see rising national living wage rates, and caregivers absolutely should be paid a really, really good wage. But the way in which care is commissioned, it doesn't allow all providers to be able to pay caregivers as much as they would like. So where does the blame lie, if you like? Well, it's got to start with the policies which shape how care is commissioned, etc. I could go on forever and a day about the political landscape and etc. But in terms of for Joe Public, if you like, what can they do when they're in hospital? I think you do as a right, as the Care Act enabled everybody to have choice over an individual's care to make sure that your needs are met. I think, whoever you are liaising with within the hospital, I think it does well to make them aware that you are aware of your rights to choice effectively, and to ask for information in terms of the local care providers within the area. And they should be able to provide you with a list of providers. Now, in the future, what we would really love to see is for hospitals to have instant access to the capacity which those providers have. And in some hospitals, they will be educated in terms of which providers are good. But some kind of little hints and tips. If you are in the fortunate position where you can pay for care first and foremost, you want to be looking at what the CQC registration rating is. So good.
Sorry,
Good
for the listeners, sorry to interject. What the CQC Explain what that is.
They are the regulators. So many people will be more familiar with Ofsted, and they regulate the education sector. So you'll see when you drive past schools, etc., you'll often see big signs saying rated as outstanding by Ofsted, and that's the best rating that you can get. Very similar in England. Devolved administration, slightly different, but for England, outstanding is the best, and good is also very good. Now, there's 5 key what they call domains in terms of a rating, and in order to get an overall outstanding, you need to have outstanding in more than two of the key domains. But ultimately, you want to go in and look at the CQC report. So first and foremost, is it rated as good or better? Excellent. Secondly, go onto the website if you can, or for a family, ask a family member to do, and have a look at the most recent CQC report. That will tell you how caring they are, how responsive they are, how well the service is managed, how well it is supported, etc., and how safe it is, importantly. So that will give you a really good understanding. And then also, it's also worth looking at some independent reviews. So homecare.co.uk is a wonderful site. It gives you impartial reviews from people who have accessed the services. And just kind of doing those kind of first kind of 2 or 3 exercises will give you a good feel for the organisation. Also worth looking at Indeed reviews if you want to look at how well they treat their staff, etc. And yeah, that'll give you a real good feel for the culture of the organisation. And then effectively, I would always say you want to have a short list of 2 or 3, and then contact them. And then obviously, most of them will want to come out and properly assess the needs and wants before they can give you a package, give you a price. But they will probably give you a range of prices so you can get a good feel from an affordability point of view. But I can certainly tell you, when you were saying about the cost to keep somebody in a bed overnight in hospital being upwards of £395 a night, you easily be able to get a package of care for a lot less than that in general. You can usually secure a living care package, and that's where a caregiver will live within your home, can provide up to kind of 12 hours of direct support to you within a 24-hour period. And that would be and significantly lesser cost than the cost to keep somebody in bed. So absolutely. But if you're not in a position where you can actually pay privately, you are entitled to funding from the state. There would be a needs assessment and also an assessment of your care needs, which would go hand in hand. But many people don't know that if they do qualify for support from the state, they are entitled to something called direct payments. And what direct payments means is that as an individual, you can choose your care provider, and you can choose to top up those payments. So if you wanted to go with a provider which isn't the local authority's provider of choice, you can find your own care provider. And then if you need to top up because your allowance doesn't cover their hourly rate, or perhaps you might want some additional care and support to do some things which are over and above the standard offering, you can top up those payments yourselves.
Fascinating. Option 2, government, local authority, somebody else paying for it because I can't afford to, does sound to me as though it's not going to be a quick solution if I'm lying in the bed and I want to go home.
Yeah, absolutely. And I think this is the real reality of why we need proper integrated healthcare, because the commissioning structure at the moment doesn't allow for that quick, accelerated hospital to home. What we are saying is the social care sector. Our caregivers carry out quite complex tasks, actually, with a lot of pressure. Effectively, they're responsible for an individual's well-being. They need to make sure their medication is managed, their personal care needs are met. And yet, almost natural solution to the jigsaw, if you like, is is not being addressed properly. And that is because we are not seeing the commissioning structures happening correctly. So there is something called the integrated care boards, who have the overriding responsibility for commissioning. And I attend so many events where we've got so many sector leaders turning up, and from all parts of the sector, government representatives, individuals like myself that head up home care companies or organisations that serve the self sector. And everybody without question is having challenges in terms of actually speaking to the right people. And so whichever government comes into power next, we really do need them to take control of this integrated care offering and fix the commissioning structure, because we have caregivers, certainly with more home care providers having caregivers that are able to provide the more clinical solution to the community, that are absolutely ready, able and willing to alleviate that pressure. But unfortunately, we can't access the funding to provide that care and support to people who sadly can't access it through the private market.
Yeah. Your experience, without trying to drill down too heavily on the detail, but I think the detail sometimes is important. I mean, the bigger picture, when we talk about funding, Labour talked about it, Tories talked about it, nobody's done it. Health and social care in the community. All the money goes to the NHS. Great that they are, but if you put it into, this is me on a soapbox, if you put it into the community, you'd have less people going to hospital. But that message doesn't seem to get through to anybody. So we are where we are. I'm just trying to work out in my head. The NHS overall, 13% of all beds are blocked because people in them shouldn't be there. They should go home. You've just said that there's a bit of an issue about commissioning, that the integrated scheme isn't working.
Correct.
Nobody's willing to give the money, if you like, to people like you and others that could deliver the job probably cheaper than the NHS having somebody blocking a bed and not being able to do the surgery, blah, 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 blah. So how do we change that? I mean, the NHS isn't cradle to grave. I mean, there's this falsehood, isn't there? A lot of people believe that the NHS look after you throughout your life. And this is a subject that's come up on the podcast quite often. Helen Wynne of Martineau Solicitors said somebody has to pay, quite rightly. And the NHS isn't responsible. Social workers and the local authorities, they could be responsible. But there doesn't seem to be anybody willing to say, okay, there's a point when we need to make some good decisions. And the good decision is we've finished our job as a hospital. Now we've got to make sure that the community is looking after the population. And that happens to have been privatised by the Labour government 20 odd years ago. So the private sector do it. Hate it or like it. That's the fact. That's the way it is. So how do we change that mindset? How do you think, you just said you've been to lots of meetings. How do we change that relationship between local authorities, social workers and the NHS and the private sector to make sure that we can deliver what the public deserve? Big question. I'm just jumping into this episode, which I hope you're enjoying, to ask for a favour. It's really important to us to get likes, shares, following and comments about the Chasing Care podcast in order to build the audience. So if you know anybody that's in the care sector or thinking about care for a family member, maybe you could like, recommend and share. Let's get back to the episode.
Yeah, it is. At any one time, there's 0.1 million people in hospital beds and 0.4 million in care home beds. So that's 500,000 in total. But in stark contrast, if you actually add up the number of people needing or receiving care at home from professional or informal caregivers, plus those with unmet need, it's nearly 15 million. But as you just alluded to then, a lot of the political focus media dialogue and funding is absolutely focused on the NH and sometimes also care homes, but more so NHS. And as we know, from the cost that you quoted before, it's not the most efficient use of the money. We know that money, if it was, or some of it was attributed to the social care side, both in terms of the preventative agenda and also accelerated hospital to home, the savings could be absolutely significant. We need to pay attention to that 15 million to reduce the pressure on the limited and expensive facility-based care. It is so disproportionate in terms of the billions of pounds of government spend on the NHS in comparison to home care. There's a myth that the UK doesn't spend enough on health and social care together, but the OECD data indicates that the UK actually spends a similar proportion of GDP on health and long-term care. But the majority of it is poured into acute hospitals. So we're at the lower end of the range when it comes to home care and community-based care. You'll know the phrase prevention is better than a cure. So there is absolutely necessary shift of focus. It seems so obvious to me from where I'm sitting that we do need to shift the dial on demand and focus on keeping us all at home where we know we all want to be and where we know people do much better. Now, of course, home care providers are primed, I believe, to engage with clients a lot earlier in their journey. And I think there's a huge opportunity there to do more and indeed innovate actually in that pre-care cohort. So I think the next government really needs to start to look to different cares of models which prioritise care in the home, but more importantly, preventative measures that look at social factors as well to ultimately extend that healthy lifespan for somebody living in their own home. And then when you kind of combine that with the powers of technology, and again, we need to see that technology-led care commissioned as well, along with AI and smart data, we really, really start to improve outcomes for individuals and start to take some of that financial pressure away from the NHS. And I think far too often we're kind of looking at the other end of the scale in terms of getting people out of hospital. And as I spoke about earlier, I think there's a huge job there for the social care sector to do, and I think we can do it very well. But ultimately, longer term, we need to move out of this kind of crisis management mindset and focus much, much more on the preventative agenda for sure.
And we're not just talking about geriatrics. I mean, I think this is something that probably in the back of my head, I've been thinking all the time. We've been talking that bed blocking, it's the elderly in beds, but it's not right, is it? It's across the piece. It can be children right the way through to 100-year-old person. It's everybody deserves care. Everybody should be supported. The bed blocking isn't just one section. It's not the over 50s that are causing it because they're incapable to look after themselves. Although I am over 50, so proof I can look after myself. But, you know, it really is quite a broad range of people that we're talking about. And the other thing that sort of jumped into my head here, and I don't know what your thoughts are on this, the government, they're building more hospitals. And I alluded to earlier that I think there's 5,000 more beds in the NHS than there were 5 years ago. They're building more hospitals. Well, that's great, isn't it? 19 out of 20 beds are filled. So that means to say there's just more people in hospital. But it doesn't fix the problem of bed blocking, does it?
No, absolutely not. It's really short-sighted. And I think, yes, we hear, as I've said, people talking about integrated healthcare, politicians talking about it. But then it doesn't translate from a funding perspective. We don't see social care being funded in order to really be that integral part of the solution that it needs to be. And that funding needs to come into that preventative space. I was at a recent care conference the other week, and there was a Dr. Chris Papadopoulos, who was a lecturer in public health, and he shared the most eye-opening videos in terms of the reality of what robots can deliver today, actually. I think one of them was the Figure 01 robot from OpenAI. And it's really, really quite spectacular and a little bit scary, actually, in terms of the advancements in artificial intelligence and robotics and how they have propelled innovations across lots of industries. And healthcare is no exception. I think the widespread use of robotics actually does have the potential to reshape the way healthcare is delivered, and that will have profound implications for providers, caregivers, and patients alike by removing administrative burdens, streamlining workflows, enhancing patient engagement, and really identifying health decline, bringing in preventative measures before health conditions get much more serious. However, I will say my firm belief is that robots will not take the place of caregivers. There is Dr. Jane Townsend from the Home Care Association. I saw she published a wonderful blog on LinkedIn the other week, and she quoted Dr. James Wright, who wrote a book called Robots Won't Save Japan. And what she quoted was that robots may someday care for us, but they will never care about us. And I think that is very, very true. But what we'll definitely see is human caregivers being able to focus more on the emotional side of support, not needing to be as concerned about admin, less room for human error, and actually overseeing the tasks that robots are carrying out. And that can play such a huge part in alleviating the pressure on the NH. But we do need a forward-thinking government to really take kind of a firm hold and not just look at what the immediate kind of crisis is in front of us, but start to look at care models for the future and how those models need to be commissioned to be effective for the future.
Robots. Yes, I've been around that subject. I had a podcast, one of the first ones we talked about robots, quite frightening in terms of what they're proposing these days. I'm absolutely on the same page as you. They're not going to replace the human. They can't. That personal
No.
touch. I see something that was advertised the other day, won't mention the name of the firm, where it almost was the TV becomes your communication portal with the clinicians, and that's going to help fix the problem of a virtual bed because they can see you and you can. No, sorry, it's not right. In my opinion, it's not. Well, it's not the vision I have for
No.
care at home.
No, absolutely not. It should be complementary, not taking away the human touch, because as I just quoted there, a robot will never care about an individual. But I do think there is a good opportunity to harness some of the smart technology that robots can provide, particularly in that preventative space, to really start to fix the problems that we're facing. I'm going to just quickly touch on, obviously, the workforce agenda here. We know that we are really, really battling a challenge when it comes to workforce in our sector. Skills for Care published its annual report. You might have read it, and the situation's dire. Vacancy rates, they're still above pre-pandemic levels at around 9.9, not quite at the record high of 10.6 from 21-22. But ultimately, we do have an issue, and we've got a lot of challenges. Workforce is declining. the vacancy rate, caregiver turnover high. I think it's around 36%. And obviously, we've had some challenges with regards to international recruitment off the back of Brexit, and then also some of the rules and legislation around the recent routes to international recruitment. So, kind of bringing all of this together, we know we need to find a way to create more caregivers, but also alleviate some of the pressures and to drive some efficiencies within with the capacity that we've got.
Yeah, not to want to dwell on the downside of our industry, because I think that most providers are very good at finding solutions, finding those carers, particularly in the private sector, private pay, which is the area that you tend to operate in. One question again, and that great thing about podcasts is I get lots of ideas that come into my head and I can ask you and then you can hopefully answer it. I'm just wondering if the purchase of services to get out of hospital is like a critical, oh my God, what am I going to do? How am I going to get out purchase, which is not what you want really, is it? Do
No.
you think there's any way that as an individual or as a family, you can maybe future proof the need for that support? I mean, I'm just thinking out loud here. If mum or dad is deteriorating and may need to go into hospital, there's normally a 6-month waiting list these days, at least 6-month waiting list with hospital, maybe longer. I just wonder, do you think as a provider, we could advise people as to how they could future-proof it? So when the time comes, when they need that care, it can be actually tapped into.
Yeah, absolutely. So I think, unfortunately, generally speaking, across our services, when people need care, they need it now. It's not something people tend to think about until they need it. And then it normally is, sadly, as you just alluded to, then one of those more kind of crisis purchases, if you like. Still astounds me how many people, just when I'm talking kind of outside of my work world, don't really understand about home care, how to navigate it, what's available, how to distinguish between a good and bad provider, what their entitlements are. It's still something that is quite foreign to people. So I know myself, along with a lot of providers that sit on the board of the Home Care Association with me, are absolutely at pains to try and educate the general population in terms of what home care is, how they can access it, and also educate individuals to attract them to come into the sector as caregivers. There is so much information out there, but I would say the Home Care Association is a wonderful starting point. There's heaps of kind of information on their website, etc., that give you some really good kind of guidance. But as I mentioned earlier, if you're maybe at the start of the journey where mum's health is slowly in decline, you might be the primary caregiver and feeling that you're going to start needing a little bit of support, a little bit of respite. Just start to do your, if you're working with a good quality provider, they will happily support you with navigating through your options. Most of them will have really good partnerships with organisations that can support you to navigate the funding side, to understand what you're entitled to. There's some, even if you feel that you wouldn't be entitled to financial support, sometimes you might be surprised. You can access things like attendance allowance and support with Blue Badge, etc. And there's organisations out there that can help you to navigate that. And a good local provider will be able to signpost you to other organisations that can help. So ask the question, say, I'm not sure what I'm entitled to financially. I'd like to explore my options. Can you recommend anybody to me? And you should be able to speak to a range of impartial advisors that can help you with everything from accessing a little bit of attendance allowance right through to if you need to potentially looking at an insurance project. So, and there's insurance providers now that are starting to come into the market to support you to take out products that can help you further down the line. There's gets a bit of a bad name, but there are some equity release solutions. There are some on the more ethical side of the scale for sure. But you want to get that independent financial advice. So look for a provider that specializes in, support for the older generation. And, there's an organization called My Care Consultancy, which is My Care Consultants, which is a really, really great service, which will be able to provide you all of that offering for sure.
Always reminds me, it's like just yesterday, my son, age 29, he said, yeah, but I don't have a pension. And I'm like, what? Age 29 and you haven't thought about your pension? Oh my God. He doesn't have a financial planner, even though I've suggested it to him a fair few times. He won't be thinking about care. Come on, Lucy. I mean, and what chance do we have? I mean, the financial service industry has been telling us about the need for a pension and all these other things for years and years and years, but still so many people don't understand what their options are and why they should start saving when they're young. I just do. And I'm not blaming right at home and Lucy for sure, but I just wonder what more could we, what do you do to help educate the public as a business? And what else
No,
should others be doing in order
yes,
to help these people?
we put out podcasts. We have generic information on our website. We have partnerships with the likes of My Care Consultant. Another one, a really great one, is Grey Matters Consultancy, headed up by a most wonderful woman, Caroline Romeo, and provide fantastic support. So we've got solid partnerships. And also we try and educate people through, as I said, through podcasts, through putting out information on our website, through newsletters. And a lot of our franchise owners as well do an absolutely tremendous job on the community engagement side as well. So they will run various different kind of community-based activities to appeal to people that would potentially either be needing to engage with their services or potentially on that journey towards needing those services, where they can educate people on what their options are. And some of the activities are really quite fun, like inclusive cricket and walking football, etc., chair yoga, those sorts of things. So if you're an individual thinks you may be needing to kind of embark on that journey, don't just necessarily need to kind of phone up the organisation. Have a look and see what's going on in the community, because a lot of the great organisations will be really trying to do everything they can to engage at grassroots level. Sadly, if you're having to deal with something like somebody that's living with dementia, that journey is a really, really tough one to deal with. And quite often, as their daughter or son, you'll be providing a lot of that support in the early days. There will be dementia cafes and the like, where you can go and meet with care organisations and other families that are also, and individuals that are also living with dementia, to support you with how to navigate that journey as well.
Keep your eyes and ears open by the sounds of it in your local community. I think a lot of people maybe feel that they don't want to approach a social worker. That's indeed, Lucy, if they can find a social worker that's going to, well, you can't find an office these days. You can't knock on the door to a social services department and ask for
No,
some support and
absolutely.
help. It really must be extremely frustrating for the family. So I think your advice there in terms of looking in your community, maybe you should speak to Age UK, Dementia
Yeah.
UK in the community, your church,
Mm,
mosque,
yeah.
ask for their opinion. Do they know? And really start asking around.
Yeah, obviously there's the charitable organisation, but there's also the home care providers that will be providing services out and about in the community. Particularly if you've got a provider that's rated as outstanding, part of what you generally need to do to get that rating is to have a really good community present, which will involve access to a host of different activities where you can get involved with prominent individuals, where you can go to for advice to help you navigate the way through the journey. There's a number of kind of impartial websites now to support you in navigating care. There's Autumna, there's Lottie that you can go to. I mentioned homecare.co.uk. You'll be able to go on there and see the directory of providers, but also impartial reviews and ratings, etc., and really educate yourself. And yes, we need more people to be educating themselves a lot earlier in the journey. Affordability of private care is an issue, and obviously the advice is to start preparing for it as early as possible. And when we're living in a society where most individuals are under huge financial pressure from trying to get onto the property ladder, many people just living paycheck to paycheck, actually thinking about retirement and beyond is something that they can't even comprehend, because they're just kind of trying to focus on the here and now. So it's tough for the younger people as well to prepare, as we might advise them to do so.
And I should just add on the CQC, the Care Quality Commission website, cqc.org.uk, if you want to find a provider across a broad range of services in the UK. That's care homes and home care. You go on there and every single provider is rated. You can see the rating, you can see the report, just like Ofsted, you mentioned that before. And every good quality care provider on their own website should show you what their rating is and link to their report on the CQC.
Yeah, it probably just think quite important to note here actually is obviously that is providers which are regulated. Now, there are unregulated providers that personally I am not an advocate for. And effectively if you go with an unregulated provider, so a personal assistant, if you like, who would be self-employed, you must remember that they are not regulated. So if they support with what we would consider to be a regulated activity, such as personal care or medication, and something goes wrong, you're going to really leave yourself in a vulnerable position. So definitely make sure that the provider that you're going with is regulated. If you're going to need anything more than kind of companionship, really, any kind of personal care, medication needs, etc., my recommendation would be strongly on the side of a regulated provider.
You're getting me back on my soapbox again, Lucy. Also, I would like to stress to the listeners, be careful that you understand the difference between a regulated care provider, personal assistant that Lucy mentioned, but also the introduction agencies that are not regulated. They effectively are an introduction agency or a directory of care providers. They provide no managed service in the background. You are employing that person by yourself, and you have to deal with all the needs assessment and all the regulations and PAYE, really, because they do offer a payroll service as part of the package, but it's not really any cheaper. I'd like to stress that as well. Introduction agencies, contrary to what they might say, are not much cheaper than a proper care provider. Fact.
And the risks are significant. So it can be very misleading if you go onto a website of an introductory agency. It can look as if you're getting the same offering as you would through a registered provider. Make sure you check that they're registered, they've been inspected by the CQC. As you quite rightly said, make sure you read the report and you're going in with your eyes wide open.
Yeah. Well, it's a subject that I could talk about for hours and hours, particularly when it's such an important purchase that somebody's under some form of pressure because of the family need. They don't understand it. They're just making a snap decision often. And if they go with a proper provider, their risk is reduced significantly. The quality of service, I know for a fact, is going to be higher than an introduction agency. Be careful, everybody out there. Please, please, please be careful. I'd like to just come back in the final few minutes, back to the NHS, if I may.
Of
Back
course.
to the bed blocking and back to the question of I want to go home. From your side of the fence, your final thoughts on mum's in hospital. She doesn't need to be there. I want her home. And fortunately, we probably can afford to pay. What do I do? How do I get mum home?
Mum has the right to come home, and ultimately, you really need to take control to secure a care package which meets her needs. We've mentioned in terms of looking at which providers are in the local area. Are they rated well? Do they have good reviews? Contact them and simply say, I want her to have an accelerated hospital discharge. These are her basic needs. Can you help? Providers will either say, sorry, we don't have capacity, or we don't have caregivers that are trained to provide that, or they'll say, yes, we will come and do an assessment at bedside effectively. And then they will be able to liaise with the hospital to give assurances that mum is coming home with a package of support that can meet the needs. And then ultimately, if that kind of intermediate support then needs to be more of a medium or long-term offering, that care provider can provide that continuity of care for mum. And obviously, as well as easing the kind of the physical burden and the emotional burden, which is so important. It's absolutely heartbreaking. As a daughter, you've got a parent that in a hospital and quite literally just begging to come home, and they're going to do so much better at home, that sadly they are at risk of contracting infections, etc., the longer they're in hospital, and you just want to get them home. There are solutions out there. Can take matters into your own hands.
I just want to pick up on one point. I just want to qualify one thing. Did you say that you will go bedside and see mum in the hospital? Is that what you said?
Yeah, they would come and they would assess need within the hospital, ready to discharge into the
Is
community.
this standard practice? Is all good providers would do this? Is this what they do?
I can't vouch for all, but definitely there are providers like us that also offer those services.
Wow. Thank you so much for your time today. We've come to the end. I've really enjoyed it. It's fascinating. It's a massive subject. I know that we went off on a number of tangents, and we can talk for hours about the industry that we're both passionate about, clearly, and we do want to provide the best care for people in our community. Really, we do. Lucy, if people want to get hold of you or your business, how do they find you?
So the best place to find us is on our website, www.raintathome.co.uk. You can then find your local office on there, and you can, if you're looking for care within your community, it is best to go directly to the local office. If for whatever reason you want to get in touch with me as an individual, I'm on LinkedIn and Lucy Campbell. You can track me down there and pop me a message, and I will endeavour to get back to you. But it's been an absolute pleasure to join you on the podcast this afternoon. So thank you very much indeed for inviting me along.
Lucy, once again, thank you for your time, and let's speak again.
Absolutely. Thank you.